Hi, this is Pat McCabe, Superintendent of the Akron Central School District. Today I'm providing the community with an update on our planning and preparation for the potential return of students here on campus for in-person learning. Throughout this presentation, I intend to focus on three topics. One, the summary of the CDC guidance. Two, information that we currently have from the Erie County Department of Health. And then finally, some of the planning and action steps that are underway. I'll start with the summary of the CDC guidance. The CDC has identified 5 key prevention strategies for school districts to follow. And these are essential to the safe delivery of in-person learning and the prevention of COVID-19 transition. These include the universal and correct use of masks, physical distancing, hand washing and respiratory etiquette, cleaning and maintaining healthy facilities, as well as contact tracing in combination with isolation and quarantine. For today's presentation, I'm going to spend a bit of time on the physical distancing, as well as some of the cleaning and maintaining of healthy facilities. In regard to masks, however, just want to reiterate that all students, teachers, and staff and visitors are expected to wear masks throughout the school day, including while riding the school bus. We do have individuals that cannot medically tolerate the use of a mask, so they are not required to do so, but additional social distancing may be necessary. Now on to physical distancing, starting with the elementary school. The CDC guidance indicated that students at the elementary level should be or could be 3 feet apart. However, teachers and staff should maintain 6 feet of social distance from other students and from other staff members. There are circumstances in an elementary school where children will be required to maintain 6 foot of social distance. These circumstances include whenever a mask cannot be worn, such as while eating, during activities where there's increased exhalation, such as singing, shouting, band, sports, or exercise, and then in any common areas where gatherings may occur, such as lobbies and auditoriums. Physical distancing at the middle and high school, however, is different. Initially, the CDC guidance says students should be at least 3 feet apart in areas of low, moderate, or substantial community spread. However, students should be at least 6 feet apart in areas of high community transmission. Now, I want you to note some of the graphics on the bottom of the slide. To the left of the slide are the blue, yellow, orange, and red threshold for community transmission of COVID-19 indicators. Most notably, the red high transmission area indicates that areas with 100 or more cases per 100,000 over a 7-day rolling average are considered high transmission. To the right of that screen is Erie County's 7-day rolling average ending on Friday, March 19th. If you look carefully and closely at the screen, you could see that there were 202.13 cases per 100,000 last week in Erie County. In other words, high transmission is greater than 100 over a 7-day average. In Erie County, our number was over 200. That indication in the information we received from the County Department of Health is if New York State Department of Health adopts the CDC guidelines, then Akron Middle and High School would still be required to maintain 6 feet of social distancing. This map of New York State indicates the areas where there are high levels of community transmission. And you can clearly see this is Lake Erie, this is Erie, and then Niagara County above us. Those areas are in red. So if New York State adopts CDC guidelines, secondary schools would still require 6 feet of social distancing. Just moving on, the other information from the CDC about middle and high school is similar to the elementary. Teachers and staff still should maintain 6 foot of social distance from other staff members. And again, those same set of circumstances would apply for 6 feet. These are whenever masks can't be worn, such as in our cafeterias while kids are eating, during activities such as singing, shouting, bands, sports, and exercise, and in common areas where larger gatherings may occur, such as lobbies and auditoriums. Some other notable considerations from the CDC. The CDC removed the recommendation for physical barriers. However, Akron still intends to use those desktop and tabletop barriers. It also eliminates or decreases non-essential in-person interactions among teachers, staff, such as during meeting, lunches, and other situations that could lead to adult transmission. It is important to note that most of our meetings now are still held virtually here on campus, and we do truly try to minimize the number of times we have staff members gathering. Finally, the CDC recommends limiting all non-essential visitors, volunteers, and activities, including outside organizations, to further prevent the spread of COVID. The CDC guidance on transportation is important and has significant limitations for our ability to get kids to school. In particular, it recommends that the distance between children on school buses be maintained at the existing level. That's one child per seat, or skipping rows. Now, we still do allow families to sit together if they're from the same household. And obviously opening windows to improve ventilation when it does not create a safety hazard. In terms of some facilities things from the CDC, talks about ventilation being an important component of our strategies to maintain a clean and healthy environment. So, recommendation to improve ventilation to the greatest extent possible by increasing air circulation of outdoor air and the delivery of clean, fresh air, to ensure that our heating, ventilation, and air conditioning systems are maximizing ventilation, to filter and or clean the air control in the school by improving the filtration as much as possible, and opening windows in the building as well as on transportation, so long as it does not pose a health risk. And just cracking a window a bit does help. I'll be talking more about what we're doing with ventilation in an upcoming slide. Moving from the CDC to what we've heard most recently from the Erie County Department of Health. Earlier this week, Erie County Health Commissioner Dr. Gail Bernstein indicated that New York State is currently reviewing the CDC guidance and that it is New York State Department of Health that ultimately sets guidance for school districts. Erie County is responsible for contact tracing, isolation, and quarantine. It does not set school policies or state-level guidance. School districts are responsible for following the state guidance, and if New York State changes guidance for school districts, that will be the standard throughout our county. So while we've all seen the CDC guidance, and I've quickly reviewed it for you today, it is important to note that ultimately we follow the state requirement. During her recent press conference, the commissioner noted that her epidemiology team has observed case clusters in classrooms that have gone to 3-foot distance between desks, with or without masks. And she also indicated that students represent nearly all school-based cases at the moment, and that is a major shift from the fall and winter when school staff were overrepresented. She didn't go on to explain the reason for that. However, one might deduce that as more school employees are becoming vaccinated, we're seeing fewer cases among the adult population. And now we're seeing most of the cases reported are student-based. This screen shows a bar graph of COVID-19 transmission in schools starting at the end of December and moving all the way through this past week, the week of March 14th through the 20th. And you can see by the trend line that this past week had 247 cases reported. So slightly up from the number that I reported in the previous slide. Again, CDC guidance is anything over 100 in an area is considered high transmission. I want to move on now to what we're doing here at Akron and we're continuing to work on. So as has been the case since the start, within our district, safety is our first and top priority. For over a year now, we have made decisions based on prudence and responsibility, always putting the safety of students and staff first. We have demonstrated that despite community spread and the need to follow quarantine orders issued to students and staff, our schools are safe and there's been no known spread of COVID-19 virus here on our campus. This is a clear indication that all of our mitigating strategies are effective in controlling the spread of the virus. Should New York State or the county provide new guidelines, we will adhere to them. That has been our practice since the beginning, and we will continue to adhere by all state-provided guidance. We are working on planning. Some things that are important to share. We do need that clear guidance from the New York State Department of Health. It's vital for us to know when we're trying to make informed decisions. We do plan a continuation of our fully remote day on Wednesday to allow for contact with remote learners and preparation for instructional content. The district must know the number of students that would attend 4 days per week, and a survey is being sent home to families. We're also exploring the possibility of a phased reentry model, starting at the primary level. Some information on teaching and learning. Given the anticipated restrictions at the secondary level, at this time, there is a need to focus planning at the elementary level. Elementary in-person learners would attend school 4 days per week, Monday, Tuesday, Thursday, and Friday. Wednesday would remain an asynchronous remote day for students who are under quarantine or isolation orders so that they can receive remote instruction. Additional days of in-person learning at the elementary school would certainly allow teachers and students to focus on critical skill development. Some information on our facilities management. Ventilation and fresh air handling in Akron Central Schools is currently above the standard. Our average classroom of 750 square feet, including the 9-foot ceilings, represents 6,700 cubic feet. The output of our heat pump units are 1,000 cubic feet per minute. The calculations put us at approximately 8.9 air exchanges every hour. Again, that's above the standard. Units operate with the manufacturer's recommended MERV filters, and our filter replacement cycle has increased over previous years. We're currently working on planning for social distancing during transitions, meals, PE, band, and chorus. I want to touch on the protective barriers again. Existing New York State guidance allows for occupancy under 6 feet with masks and barriers. However, CDC guidance does not require barriers. Given this contradiction, we still believe it's in the best interest of our students and staff to have barriers in place. Since September, 2,000 desk shields have been in place in classrooms and in our cafeterias. An additional 500 shields have been ordered for the elementary school, and those are expected to arrive in 2 to 3 weeks. In regard to cleaning, all cleaning is done in accordance with the CDC and New York State Department of Health guidelines. Currently, the district is seeking to hire an additional daytime cleaner position so that we can have more opportunities for cleaning throughout the day. I mentioned transportation and the fact that the CDC has not changed their transportation guidance, and I want to speak more on that now. So while they have made adjustments to social distancing in the classroom, the guidance for the buses has not changed. Assuming the CDC guidance on transportation is adopted by the New York State Department of Health, and there are no changes in middle school and high school transportation needs, transporting elementary students still presents us with some challenges. We currently transport approximately 25 to 33 students per bus run. That's about half of what we would do in an ordinary year. We would need at least 3 additional bus runs just for the elementary to transport our kids here to school. Currently, we do have enough buses. However, we don't have enough certified and licensed bus drivers for those additional runs. A parent survey will be conducted to determine the number of families that will be attending more days, that would like to be attending more days of in-person instruction. The parent survey will solicit information on the number of families that would be willing to transport their children to and from school. The district is seeking to hire additional part-time drivers. People that are interested in becoming a driver can visit the district website or contact the Transportation Department directly at 542-5026. A change in the New York State Department of Health guidance on transportation would cause the district to amend some of these plans. I want to point out that the success of our current model is due in large part to the dedication and hard work of our district staff. We are pleased that many of our teachers and staff have been able to obtain vaccines and appreciate that school employees are being given a priority in obtaining appointments to be vaccinated. Our facility staff continues to work tirelessly to keep our building clean, well ventilated, and in compliance with all CDC required protocols. Finally, we are grateful to all of our parents who monitor their children's health daily, keep our nurses informed, and schedule appointments with a pediatrician when their children are experiencing COVID-like symptoms. Should we be able to have more days for in-person learning, parental monitoring of student health will be an essential factor in controlling viral spread and reducing instances of quarantine. I want to conclude just by noting that we remain hopeful. We know that our children are best served when they are with us each day, and we are certainly willing to make all the adjustments here in school that we possibly can. Again, to emphasize, it's vital that we have guidance from the State Department of Health. It's vital that we have information from parents on their willingness to send their kids to more days. Please be on the lookout for the survey and complete it as soon as possible. This is just one of the many updates I've been providing you throughout this pandemic as we learn to live with it and hopefully live without it in the near future. I will continue to give you updates as the information becomes available. I wish you the very best. Have a great day.